Today, the Winnebago County Health Department is announcing 6 more positive cases of COVID-19 for a total of 30 confirmed cases in our community. And it's important to understand the ages. They range from their 30s to their 60s. So this is now the 3rd day in a row that we've had multiple positive cases to report. We know that we're starting to move up on the curve. We talk about we wanted it to flatten. We're kind of on the incline here. And yes, the one we need to talking about flatten, we need to continue our efforts. As the curve continues, we know that the disease is spreading in our community, and the chairman clearly stated it. You can't tell by looking at someone that they have the disease. But at some point in this community, everyone will know someone who's been impacted by COVID-19. And while it's a novel disease, and we expect to see a rapid spread, many around you will have the disease. That is, unless we can prevent the exposure. And every day I talk about this because it's important to understand. The only tool we have right now is preventing an exposure. We don't have a medicine. We don't have a vaccine. So what we all have is the actions that we can take every day to prevent the spread. There's a new dashboard out there. As people are at home creating this information, we can look at it on a daily basis, out by Unicast. And it grades communities on a scoreboard to really kind of take a look at how well are we doing on our social distancing. I'm disappointed. Winnebago County only has a B-. And when you think about that, and I'm going to borrow a phrase from the mayor, B's get degrees, but here B's may get disease. So we've really got to think this through. We've got to stop our mobility on. We've got to stay home and stay put. So again, we're asking everyone, this is the tool that we have. It's not a modern tool. It's not a highly technical tool, but it's something every resident can do, which is to stay home and limit travel to only essential food, medicine, medical appointment. We've talked about this. I continue to see very crowded parking lots with multiple individuals going into a store to shop for a family. You are not only putting risk of the workers, the essential workers in the store, who are making sure that we have the goods and services that we need, but you're also placing your family members at risk. And so again, we implore the community to continue. We've got to do better than this. And you can certainly look at the grades, and I said, I'm going to compare ourselves. The city of Chicago has an A-. Come on, we can do better. Cook County, we can do better than this. So most of you know that we're taking a lot of efforts to conserve personal protective equipment. The other area that we're going to talk about today is personal masks. So we're beginning on this, the importance of masking of what we're going to call our essential workers. These are not healthcare workers. These are people working in essential businesses that we've deemed as needing, grocery stores, delivery services, and the use of what we call personal or cloth masks, masks that are made by residents of our community. So we're going to be putting out a request that community members help us to make masks for our essential workers that are not healthcare providers. We want to conserve our surgical masks, our N95s, our gloves, and our gowns for the workers that are in the healthcare system. But we understand that this may be a way, and people have asked, why now, why at this point, right? As we kind of move through it. Well, we know the guidance continues to evolve. Some of the data coming out says people can be infectious 2 days prior to before they show symptoms. We know people are most infectious when they show symptoms, but again, that time frame when a person doesn't even know, it becomes important. They can wear a mask to protect them, from touching their face. I always say it's not a surgical grade mask that's going to protect them from contracting the disease from anyone else, but it stops potentially that transmission to others, as well as our habits about touching our face after we touch something that, is part of who we are. Adjusting our eyeglasses, I have to really kind of think about that when I come in here. All the times you touch your face to move your hair or something else. Those are things that those kinds of masks can do. Now, we will be putting data, or information, I shouldn't say data, information out on our website about how to make the masks, how to give them and deliver it to us. I'm also going to put another caution out there. Fabric stores are not an essential business. Many people know that you can order fabric online, you can order the essential materials online, but we will not be encouraging any store to open up who's not essential to become essential for this activity. But we know that our community has wanted to provide and support us, and we needed ability to identify when those masks could be used, how they could be used, and how to bring them into our system so that then we could distribute them to our essential workers in our community. So we're going to ask that you go to COVID-19 at WCHD.org to get added to a listserv so that we will send the directions out to individuals. And again, these will then be distributed to individuals in our community who are providing essential services. And I keep, we are all on a kind of a little campaign. You might see it on our social media pages. You're all out here in the community trying to report. And we need others to stay home so that we can continue our essential businesses. Because again, the importance, it's the tool that we have today to flatten that curve, to make sure that we lower the mortality, which is the death rate, and lower the morbidity, which is the illness rate. We need to make sure that we are working effectively as a team. So I understand this is very difficult. We're coming into weeks 2 and 3. The weather's getting nicer. But again, we need to be vigilant about this. It's like taking your medicine every day. You can't skip a day and you go out for a non-essential service. So again, thank you for getting the word out. We need to continue to watch and monitor. We'll be talking as the days come along a little bit more about the models that we're using, about why we're concerned, where we think peaks and curves are occurring, because we're getting more data at this time. But we need everyone who's at home, stay home. Only go out for essential services, and only one person going out for the essential service as needed, so that you can limit the risk to your family and the rest of our community and essential workers.